Good morning, everyone. Good morning, and thank you so much for joining us this morning for Stigma, Measure It, Act It, and End It, community leadership session to combat HIV-related stigma. Before we begin this morning, the HIV 2020 conference organizers have asked me to share a few important announcements. The HIV online sessions are simultaneously available in English, French, Portuguese, Russian, and Spanish. Please choose the audio channel for the language of your choice by selecting Interpretation and then the language. Mute original audio to only hear the interpreter. HIV 2020 online sessions offer a safe and neutral space for the sharing of knowledge, experience, skills, and opinions in a mutually respectful manner. HIV 2020 Online operates on a zero tolerance policy for any kind of bullying, harassment, abusive use of language, aggressive expression of opinions, or any such undesirable behaviors. This includes any activity during the Zoom session or on HIV 2020 online social media platforms, including Facebook, Instagram, Twitter, YouTube. Anything that may cause distress to panelists, speakers, translators, and/or participants. Session participants who engage in such actions will be immediately removed from the session with no prior notice. As a reminder, the HIV 2020 online session is being recorded, and it will be uploaded in the HIV 2020 online languages in YouTube and other social media channels. This session is also being live streamed on Facebook and on the HIV 2020 online Facebook page. We will have a Q&A after the panelists, and we ask that you share any questions for the Q&A via the chat. And I would just remind you guys to be mindful of revealing any personal particulars, name, age, or country if you're not comfortable sharing that kind of information during the session or when you're interacting with others. So with those announcements out of the way, I'd like to say again, good morning and welcome to this exciting session. My name is Sophie Brion. I'm a human rights lawyer working with the international community of women living with HIV, and I'll be moderating today's session, Stigma, Measure It, Act on It, End It, community leadership session to combat HIV-related stigma and discrimination. So HIV-related stigma, which is why we're all here this morning, is irrational or negative attitudes, behaviors, or judgments driven by fear. And this stigma results in discrimination, which is unfair treatment, unfair laws and policies. And HIV stigma and discrimination are widespread. They're very well recognized as persistent challenges to the health and well-being of people living with and affected by HIV, as well as the success and impact of the HIV response. It results in restricting access to prevention, testing, and treatment services for those most at risk. We often think of stigma and discrimination as occurring in a health sector, but the stigma and discrimination occurs in many other settings, including education, the workplace, the justice system, families and communities, and emergency settings. HIV-related discrimination can also be compounded by other intersectional forms of discrimination, including discrimination based on race, sex, socioeconomic status, sexual orientation, age, gender identity, and national origin, and can result in unfair and discriminatory treatment of key populations, which include gay men and other men who have sex with men, transgender people, sex workers, people who inject drugs, women and girls and other groups at higher risk of acquiring HIV, including migrants, prisoners, and other incarcerated people. Unfortunately, discrimination can also become institutionalized in laws and policies and practices that negatively impact people and marginalized groups living with HIV. Just a few statistics before we get into the discussion are that according to UNAIDS, 25% of people living with HIV report experiencing some form of discrimination in a healthcare setting. People living with HIV who perceive high levels of HIV-related stigma are 2.4 times more likely to delay enrollment in care until they're very ill. There's a ton of impacts of stigma and discrimination on women. 1 in 3 women report experiencing at least one form of discrimination related to their sexual reproductive health and rights. And 76 countries have laws that specifically criminalize HIV non-disclosure, exposure, and transmission for prosecution based on general laws. 86 countries criminalize same-sex relations, and some aspects of sex work are criminalized in 84 out of 110 countries. All these forms of stigma and discrimination result in people living with or affected by HIV and being denied their rights. And community-led efforts have led the way in calling out stigma and discrimination as a critical barrier for people living with and affected by HIV, and over time have offered some really innovative and effective strategies to reduce and eliminate stigma. Now, ending HIV-related stigma and other harmful stigmas are widely recognized as critical to the success of the HIV response and shared global goals, like the Sustainable Development Goals and targets by 2030, including ending AIDS. And as a result, there's been a huge proliferation of legally binding obligations and human rights treaties to eliminate HIV-related stigma and discrimination, yet stigma and discrimination remain a very serious barrier to the success of the HIV response. So we're here today to discuss transformative and disruptive action to accelerate efforts to end stigma and discrimination. And before we begin, with the great panelists that we have today, experts and advocates, let's watch a short video which will frame the discussion for this morning.
Next to us, there are people who face challenges every day. Some of them used to do drugs or went to jail. Some were forced to have sex for a fee. Some were born with HIV or got infected because of carelessness. And some are suffering owing to society's attitude towards gays and transgenders. But today, they are united as communities, and together they win. Every day we help ourselves, help others like us. We are the first who fight the HIV epidemic. We are the communities of people living with HIV. We are the communities of people who win. Communities will end HIV.
That video always gives me goosebumps because it reminds me of the power and potential of community to really shift the needle on stigma. And I'm really excited this morning to have the honor of introducing a number of people who are going to be joining us to discuss how we can measure it, act on it, and end it. And they're really a fantastic group of advocates, activists, and experts, and I've been really excited talking with them over the past few weeks as we've planned this great panel. So the speakers that we're going to do it in two sessions. The first session will be joined by Sasha Volgina, who's the program manager at GNP+, Harry Prabowo, who is the regional coordinator for the Global Partnership to End Stigma in Asia Pacific, and is a program manager at APN+, which is the Asia Pacific Network of People Living with HIV, and Valeria Rachinska, who's a regional coordinator for the Global Partnership and the head of the regional policy team at 100% Life, which is the former All Ukrainian Network of People Living with HIV. In the second session, in the second part of the panel, we'll be joined by Anna Sango, who's the People Living with HIV Stigma Index Advocacy Officer at GNP+, Dong Do Dang, who's the National Coordinator at the Vietnam Network of People Living with HIV, and Pim Luz, who is the People Living with HIV Stigma Index Officer at GNP+. So without further ado, I will go ahead and get Sasha to lead us in and talk to us about the Global Partnership.
Thanks a lot, Sophie. Thanks a lot for great introduction. And I will talk about the Global Partnership, and I think it's very much in line with the video, because the whole idea of the Global Partnership, the whole construction was actually initiated and done by the communities. Next slide, please. Even more. So Global Partnership, one more. Global Partnership was actually, it was a call for action from the side of the non-governmental organization delegation for the Program Coordinating Board of the UNAIDS, when the communities and civil society have asked for action around stigma and discrimination, because we were pretty tired of hearing how it is important to do something around stigma and then not observing a real action. So we called, can we go back? Sorry for that. And we asked for action. And our call was supported by UNAIDS, by UNDP, UN Women. We as GNP Plus have joined this call from the PCB and JOY delegation, and recently, very recently, Global Fund also have joined as a co-convener the Global Partnership. So what is the idea? The idea is that governments should measure the progress around stigma, should implement the interventions, and should report back on the global level how they are doing around stigma. And also the idea is that all the work around stigma have to be well coordinated, not overlapping, not, you know, like really very, very good coordinated between all the stakeholders. And also we are capturing all the good practices that we have. Next slide, please. Because from the very beginning, it was initiated by the communities. We were those who come up with the structure. We think about our lives as the whole and about ourselves as a human being. So the most developed settings, of course, are justice and healthcare settings. But we all, as people living with HIV, we know that our lives doesn't consist only of the healthcare. We also have families, we have friends, so this household and community level is important for us. What's going on with the stigma and discrimination at our workplace, in educational settings, in emergencies and humanitarian settings? So it was crucial and key for the communities that Global Partnership has to be focused on all of these settings, not looking at us from, like, how to say that, medical point of view. Next slide, please. So what happened next? We have come up with a guidance around stigma and discrimination, and have invited 30 countries for the first wave to join the Global Partnership. What it means? It means that the countries which have joined the Global Partnership have promised, committed, they have took obligation that they would work together with the communities, which is absolutely crucial for all of us. They have to implement that together with us, with other UN partners, with academia, with private sector and other stakeholders, donors, of course. So they have to assess the current state of the HIV-related stigma and discrimination in the country. Then they have to take action. They have to choose 3 settings for the first year, let's say justice, I don't know, healthcare and emergencies, and implement interventions there. And then during the next 5 years, they have to implement actions around all the settings. They have to allocate resources with support of the donors or through their own state budget, but they have to allocate concrete resources to implement these interventions. And they have to monitor and report annually on the global level using the existing frameworks about the progress they have achieved. Next slide. So here's the countries which have, 30 countries were invited. Here's the countries which have joined. For the Latin America, it's not only Jamaica and Argentina, and by now it's already Panama and Honduras are going to join very recently. We have in Asia and Pacific, we have, and Harry will talk about that more, 4 countries, PNG, Laos, Nepal, Thailand. We have quite a lot of countries which have joined from the Central and West Africa: Cote d'Ivoire, Central African Republic, Senegal, Democratic Republic of Congo. Next slide, please. And from East and Southern Africa, South Africa, Mozambique, Uganda. And we have from Eastern Europe and Central Asia, we have Moldova, Kyrgyzstan, Ukraine, and Valeria will talk about that. And Kazakhstan is also going to join. And in MENA region, we have Iran. Next slide, please. In some countries, as you can see, countries have chosen the interventions. In some, they don't. So here are the questions which communities should ask themselves. They should find out if the country was invited, if the country have accepted the invitation. If the country have accepted the invitation, have they chosen the settings, the areas where they're going to work? Do everyone is aware about that happening? Are all the communities at the table? How actually this process is built? Are the communities included? And we from the side of the GNP+, we are supporting the communities and civil society engagement into that implementation. So you have to come to us, you have to come to your regional coordinators, to your focal points in your countries, and find out at what stage you are. Then you have to come up with the priority interventions and advocate for them, for the countries to accept them and to implement them for them. Next slide, please. We have also made very good guidance for implementation. Here it is. You can find it on the website of UNAIDS, and you also can ask us at GNP+. So it describes fully, what has to be done in each of the settings, what are the priority interventions, what you have to choose of the most appropriate ones for your country. All that is built also together with the civil society. This guidance was worked out by the rather huge group, technical working group. 24 members of this technical working group were from the side of the civil society and communities. So we were using the interventions which we know are working on the ground level, which we know they are effective. You can find all that guidance there. Next slide, please. There is some confusion around that because we've introduced the settings, and previously UNAIDS and Global Fund were using key human rights programs. So you also can find the guidance from us, how they are related. So for example, we were using the interventions we know, like for increasing access to HIV-related legal services, for example. So it will mean that it has to be, your country has to pick up communities and justice settings and implement this kind of interventions. Next slide, please. Or, for example, you have key human rights program, which speaks about the training healthcare providers on human rights and medical ethics related to HIV. Then it means it would be two areas, healthcare and education. And then you implement the intervention. I think that's it from my side by now. Turning it back to Sophie.
Great. Now we will hear from Harry Prabhu. Take it away, Harry.
Okay, thank you, Sophie. All right, so good. Hi, everyone. So good morning, good afternoon, and good evening, probably. So for this opportunity, I would like to explain a little bit about technical support from regional PHIV network towards community and civil society at the country level. Next slide, please. So as a start, I think I will just want to try to give you a brief update on the current situation in the Asia Pacific. Currently, as Sasha mentioned, we have 4 countries that joined the global partnership. The last one is Thailand, and then the setting that they've been using is basically a healthcare, justice, and household setting for PNG, Nepal, and Laos. And for Thailand, they a bit different. They want to like to choose healthcare, justice, and workplace. Moreover, the national coordinators also been assigned to help the process of the global partnership at the country level, basically to ensure civil society and community is fully engaged into the global partnership processes. And the overall engagement process of civil society and community is led by, of course, GNP+. Next slide, please. So the expected result from the civil society and community engagement in the global partnership is basically we want to civil society and community are fully involved in all stages of the global partnership implementation. And also we want to make sure all resource and mean necessary to be equal partners and participant making processes from the global partnerships. And lastly, we also want the global partnership is receiving effective and quality feedback and contribution from the civil society and community. Therefore, the strategy, the implementation that we use, we try to make sure that inclusive and accountable to their constituency. The second is to meaningful involvement in decision making, which is related to all aspects from the implementation of global partnership and the country processes, started from the identifying, implementation, monitoring, evaluation, learning on each focus area that already committed by each country, and also to give feedback to GNP Plus or as a global partnership co-conveners and the GO delegation, global partnership technical working group about challenges and progress in terms of the global advocacy and the partners development. Next slide, please. So as we all facing that COVID-19 affected all work that we've done so far, so similar situation also apply with the global partnership at the country level. So this has become a really quite challenges. Therefore, the national consultation that at the beginning we were planning to conduct through face-to-face now had to be conducted virtually. On the other side, we as a global partnership and technical working group has produced documents on applying the evidence of what stigma and discrimination in sex settings in the context of COVID-19 response. Again, as Sasha mentioned, you can access this document in GNP Plus or just directly email to us. Next slide, please. So the work so far by the global partnership at the country level, especially in Asia Pacific, we have Papua New Guinea. I know it's a bit far. Papua New Guinea, they have much of benefited from the situation because they have just established the advocacy consortium, key population advocacy consortium, whereas the office located at the UNH. So therefore they have strong engagement with an agency, with stakeholders in the country, as well the human rights commissions. And since COVID-19 is on and off in terms of lockdown, so whenever they have time to have a face-to-face, so they will do the consultation with the community, just applying during the CCM meeting or technical work group meeting, or even during the event like film festival that they're planning to conduct this month. So let's go now, we move to Nepal. Nepal has started engaged with the UN agency, but their approach is try to using a stigma index a discussion toward the process. But at the beginning, they have kind of a little bit of problems in terms of the engagement with the UN agency, but they manage to get us fully support from the VLHL community and basically they're ready to roll out the online national consultation on global partnership. Next slide, please. So Laos PDR, another again, Laos PDR has the process of, they try to make a foundation how to encourage community to be more able to engage into the global partnership. So they are more focused and start their work into stressing on how to utilize social media platform. By that, they try to rebuild community capacity for their engagement into the global partnership implementation. The last and very last one is the Thailand. I think this is the most progressive countries in terms of the global partnership in Asia Pacific, since they are already setting up the Thailand Partnership Committee for Zero Discrimination, where civil society, community, religious leader has to be, they all get together under the, and the CCM also in there. And they also already produced a clear framework where civil society and community are able to engage into global partners implementation in the country. And right now they are just finished to finalize the national costed and multi-sector operational plan for this zero discrimination of the global partnership. Next slide, please. So in terms of Asia Pacific regional approach, so basically we try to work closely with national coordinators in terms to roll out national consultation, including an advocacy and communication campaign. And also, we also try to basically to make sure the stigma and discrimination is not just become a meaningless event in society, but it should back as a mainstream issue on HIV response. And also, we also provide technical support to the national coordinator for their meaningful engagement of civil society into country global party processes, and to ensure the national global parties to produce safe channel for feedback mechanism on stigma and discrimination. Last, also, we also produce a basically the idea what I'm trying to approve is to make a collective works among countries to join global party in Asia Pacific and establish sharing South-to-South learning process. Last slide, please. So this is the way forward. So we try to encourage national coordinators to continue their works and to ensure civil society to fully and have meaningful engagement and conduct, and as my part, we planning to conduct a regular meeting and to make sure the stigma discrimination is back as a mainstream strategy on HIV response in the country. Back to you, Sophie.
Thank you for that, Harry. Now we're going to hear from Valeria. Please go ahead.
Hello, everyone. I'm Valeria Rachinska, and I will talk today a little bit about which opportunities global partnership will give us, and which benefits we already have from this partnership. Next slide, please. Ukraine started to be the part of the global partnership already in 2018, when its first national consultations were conducted all over the world in 5 countries. And when the GNP Plus, together with UNAIDS, actually announced a calls, Ukrainian governments didn't react very well. It was lack of political will to participate, and it was a lot of significant changes in the political situation. So we did expect that Ukraine will be the first one who will join, but it didn't happen. But finally, it happened because of good collaboration between government and community-led organizations. And even not 3, but 4 settings were chosen by our government. And it was possible only because JIPA principles have been followed during all the processes. And we could prove our government how it's important for us to have this partnership and how important for the communities if our country will commit something, will give some commitments to all the world. The next slide, please. And during the multi-stakeholder meetings that took place in 2017, the main advocated targets were identified by the communities. And again, in 2018, during national consultations, this advocacy targets were confirmed by the communities. And this is decriminalization, depenalization, harmonization of national legislations, and eliminating of stigma and discrimination. Why for us this was so important and still so important? The next slide, please. You know, look at this picture. It sounds like last century, like things that never happened in this world. But we could easily add our pictures at this slide, because it's we right now who illegal in this world just because we are sick or having sex or we being gays or transgenders or doing something that's not acceptable or illegal, considered like illegal by our society. And we don't want to be in this picture like people against whom discrimination and stigma, it's illegal things to do. The next slide. Actually, thanks to our partners, to GNP Plus and to the Global Fund and to the UNAIDS, that they share our concerns, that they created this partnership, and we already benefit from this partnership and for promoting this partnership by the Global Fund. We have advocacy plan and strategy. We have community driving decisions, and Global Fund was pushing a lot all the national stakeholders to include interventions that proposed by the Global Partnership to the country proposals. So, but this great advocacy tool could be used together with stigma index, because in Ukraine, you know, we are one of the leaders in the world about stigma index researchers, and we do it with a great frequency. But you know, never we used this stigma index result for the right targeting and for developing right interventions. So we got this chance because of the global partnership. We can provide measurable targets, and we can implement these activities that we really need. The next slide. We already have some activities in justice sphere, and these activities already included in the Global Fund grant. So we will have the first innovative parliamentary platform on HIV fight for health, that driven by the communities to advocate human rights and changing of the legislation. And this will be policy making by the communities, proposed by the communities, based on our experience, based on all our stigma and discrimination that we have faced in our life. And together with lawyers, together with parliamentary members, we will have this platform to provide our changes and our project proposals of laws directly to the parliament. So, and this is for us, it was a big fight to have this platform, and we actually won, and with the participation of Global Partnership. So the next slide, please. And actually we have a lot of activities in healthcare. We just mentioned some of it. Mostly it's trainings and development of educational online courses that developed by the communities for the doctors, because we want to show how to treat us, how to understand us, how to reach our needs, and we want they know about it from us, not from someone else. The next slide. So also we provided some innovations already to make Global Partnership really good tool and give to Global Partnership some more information. We implemented indicators of the Global Partnership based on the Global Partnership in the reported system of the Public Health Center. So they will use this tool, and we can provide more targeted information back to the Global Partnership. And also, human rights model in DataCheck mobile application was added, and the first level of reporting is based on settings identified by Global Partnership. So we will have great monitoring and evaluation tool as well. So, and I'm done with this. I will be glad to answer any of your questions, and let's fight for our lives. Let's fight against stigma and discrimination, because our lives matter.
Thank you so much, Valeria, for that really impassioned presentation, and also thank you to Harry and Sasha for sharing some really exciting examples of the ways in which the Global Partnership to End Stigma and Discrimination is already accelerating community-led efforts and putting a practical lens resulting in costed action plans and specific country commitments beyond the usual verbal commitments down to work plans, action plans, and financial commitments. I think it's really important to highlight the ways in which communities are leveraging this partnership to build political will within countries and take advantage of this opportunity to kind of accelerate these strategies and innovations, as Valeria shared, that are being developed by communities to respond to the needs of communities, and particularly to people living with HIV. When we think about how this came to be and what's driving the understanding of stigma, we have to think about data. How is stigma and discrimination being measured? And as we know, how you measure it is how it gets responded to. So our next panelists are going to help us understand both how data is being defined and redefined for stigma and discrimination, to measure it and to understand it, and also to then leverage that data for the kind of action that will result in building this political will and pushing for community-led interventions and innovations. So I'm going to introduce Anna Sango, again, who's a Stigma Index Advocacy Officer at GNP+, and she's gonna help us understand how to measure it and act on it.
Sophie. Hi, everyone. My name is Anna, and I'm based here in Harare, and I'm the new Stigma Index Advocacy Officer. And I would just like to share a bit around the Pillar HIV Stigma Index 2.0 and the relation with the advocacy work that we seek to accomplish within the different communities, and also with the work that we'll be doing with the different networks. So I think from the previous speakers, we've heard of amazing examples around the data and information that has been collected and the work that they've also moved on to do with that data. And we know that for data to be important and for it to be relevant, we need to be able to translate it to action and ensure that it is used for the relevant communities, and it's also really addressing the challenges and the issues that the different communities will be facing. So that's where the advocacy component really then comes into the whole PLHIV Stigma 2.0. Next slide. Next slide, please. So the Stigma Index project, as you all know, it is governed by the Global Network of People Living with HIV, also with the International Community of Women Living with HIV, as well as UNAIDS. So it was first launched in 2008, and so far has been implemented within 100 countries. So there is an updated version, which now we're calling the Stigma 2.0, which was then launched in 2018. Due to the shifts within the global trends around HIV, around the response, and also around the way that people are addressing certain challenges and issues that are linked with a stigma or discrimination targeted at various key populations. So basically the research is more of community-based, And it really uses a standardized tool, and there is a methodology that is used in accordance with that tool. So mainly it's looking at documenting the experiences of people living with HIV, and also looking into some of the challenges that they face when it comes to stigma and discrimination that is related to them being people who are living with HIV, and also looking at the different intersectionalities that accompany that. So for us, it is important for all you to know that the product is as important as the process. And we really value the Stigma Index tool because it has really been eye-opening and really informative in terms of understanding the different contexts of communities, and also understanding the various networks that are working with people living with HIV, and also being able to even understand communities of people living with HIV, and to be also to really push and look through some of the either discriminative policies or laws, or also to even look at some of the discriminative behaviors that we could be able to support and work with and be able to address in accordance with the communities and the networks of people living with HIV. Next slide. So the project, when we look at it, it does not only end with the final report, but it goes on to ensure that the evidence that has been gathered is going to be able to be utilized to actually improve policies, or rather influence the different policies, or be it programming, and also be able to ensure that the different constituencies are able to advocate for changes against stigma and discrimination. But then what we need to be doing to ensure that these results are turned to action is for us to ensure that whenever the Stigma Index implementation is being rolled out, we ensure that there's a budget line that supports the PLHIV networks. We ensure that there is also a follow-up to the advocacy. So it's very important that we're able then to know how best we can translate that data that we've collected to progressive action that can happen, so that we are able to address the challenges. It is also very important to include various and relevant stakeholders that can participate within this process. So this could be in the form of a steering committee, and you could have different partners that are part of that steering committee, and that can help in the implementation of the PLHIV Stigma Index. And then also it's important at country level to ensure that there is a development of an advocacy plan that is specific and clear, concrete advocacy actions that are also really detailing the roles and the responsibilities of each different actor. And then that can also be able to really illustrate the changes that can be able to occur within the rollout of that plan. And it is also important to keep track of that advocacy plan to ensure that there's adequate monitoring and evaluation, and also learning from that particular advocacy plan. Next slide. So for the next slide, I want to share an example from Zimbabwe. So this is one example that that the PLHIV network in Zimbabwe drew from, and they actually moved on to have an advocacy activity after the rollout of the Stigma Index. This was the Stigma Index 1.0. So from the data that was collected and from the slide that we're currently looking at, you could find that these were there was 10.6% of the total of about 1,818 respondents who reported certain exclusion or certain discrimination when it came to religious activities. So this was more like the baseline indicator that then propelled the network to engage in various activities to be able to address stigma within the religious setup. So you'd find that from the information collected, this then shows how important it is to be able to have a clear advocacy plan in place. Because once you've collected this data, you need to act on it. And when you act on it, you are then able to also effect change and also be able to address some of the issues that your community will be facing. Next slide. So in addition to the in-depth interviews that were done and the work that followed through the data and the statistics that were there that showed the amount of people who are being discriminated according to their because of their status within the religious setup, the network went on to produce a video documentary. After producing that video documentary, they went on also to develop a document, which is a stigma reduction framework that was targeted at religious leaders and at also religious communities. So initially, the framework was to support people living with HIV to be able to advocate for their rights and to be able to ensure inclusion within spaces and to be able also to address the issues and the nitty-gritty issues that they were facing. So you would also find that within the video documentary, different participants shared their experience, their real life experiences and real life stories of what they had come across as people living with HIV. Next slide. So with my last slide, I just want to, thank you so much, Sophie. So with my last slide, I just want to encourage communities of people living with HIV to ensure that they really think more progressively around an advocacy plan in terms of the data that they collect when they implement the stigma index, and to ensure that that advocacy plan really seeks out to bring the issues out and address the challenges that people living with HIV will be facing within their communities, because data needs to speak through advocacy. Thank you.
Thank you so much, Anna. That was really, really informative and really, really helpful. Before I move on to our next speaker, I just wanted to give a small shout out to all those watching us on Facebook Live. And just a reminder to those of us who have joined on Zoom that if you have any questions for the panelists or for the discussion, there's a Q&A box where you can put those. And so now, take it away, Dong.
Hello, everyone. Good morning, good afternoon, and good evening. Just want to say hello from Hanoi, Vietnam. In my presentation, I would like to share the experience of, from Vietnam. Yeah, so I totally agree with Anna that the PHIV stigma index is not the end. It not end with the final report. Yeah, so it's very important for us to know the finding and use it to make it to become the really advocacy thing. Yeah, so in Vietnam we are start the stigma index 2.0 this month. But in the past, we done this in the first round in 2011 and the second round in 2014. So look at the result from 2014 from the finding related to HIV related stigma discrimination in healthcare facilities. So we found that the overall finding reveal concern about quality and confidentiality of healthcare and HIV testing. And in the second round of stigma index that we did in 2014, there were 1,625 PHIV who involved in the interview. And 60% of respondents reporting not being able to discuss their treatment with healthcare workers. 3.6% of female sex workers reporting being denied healthcare services. And 3.1% of all respondents and 5.6% of PWIT were coerced into testing, and 7.6% of respondents were tested without their knowledge, and over 1/3 of all respondents, around 37.5%, and nearly half of PWIT, around 45.3%, reported their status being disclosed to others without their consent. Yeah, next slide, please. We take the most important recommendation on the issues that the quality of healthcare worker for PHIV, particularly interaction with healthcare worker, especially for MSM living with HIV positive MSM, should be improved through education and training for healthcare worker in collaboration with the network of PHIV. And the training on anti-stigma for healthcare worker and coordinating with the self-help group of PHIV to improve the quality of medical care for people living with HIV. That's the most important thing, most important recommendation that we are focusing on from the finding. Yeah, next slide, please. And yeah, from the finding and the recommendation, and we turn it into action. The good practice we would like to share with you is the engaging community network to measure stigma and discrimination in Vietnam. Back to the 2016, VNP Plus, the Vietnam Network of People Living with HIV, together with UNAIDS and the Vietnam Administrative of HIV/AIDS Prevention and Control, we call VAAC, under the Ministry of Health. We developed and piloted a training initiative to reduce stigma-related, HIV-related stigma and discrimination in healthcare setting in Ho Chi Minh City, Vietnam. Ho Chi Minh City is a fast-track city. And UNAIDS and VAAC supported the Ho Chi Minh City Provincial AIDS Center and VNP Plus to adapt the survey tool and use to assess HIV-related stigma and discrimination in selected healthcare setting in late 2016. And the survey results were then used to develop the training manual, which were used to pilot training for health workers in selected healthcare facilities after that. And the involvement of VNP Plus in the process were vital to success of the pilot, and it was described as a good practice in the background document of the special session of the UNAIDS Program Coordination Committee in stigmatization and discrimination in healthcare facilities in December 2017. With the special attention given to strong participation of VNP Plus from process of planning, implementing M&E, and training for healthcare worker. Yeah, next slide, please. Yeah, after a lot of the effort from the community and the partner from 2016 and until December 2017, the Minister of Health has been issued the directive on strengthening HIV-related stigma and discrimination reduction in healthcare facilities here in Vietnam. And few days after that, the Director of Vietnam Administrative of HIV/AIDS Prevention and Control also issues the guideline on reducing HIV-related stigma and discrimination in healthcare facilities. So that's what two very important policy documents that our government has been issued in at the end of 2017, after a big effort from the community and partner focus on the reduction of the stigma and discrimination. Next slide, please. Yeah, after that, some partner in Vietnam, they have started the stigma and discrimination quality improvement program. So as a follow-up, a baseline data collection completed in September 2018. A second round of data collection has been conducted in other 3 provinces from Q3 of 2019, when after the stigma and discrimination quality improvement program has been started. And as part of a VAAC broader approach to stigma reduction, all provinces have been requested to report on progress of implementation of the activities on reduction of HIV-related stigma and discrimination in healthcare setting in May last year, 2019. And the plan of ongoing coaching of participating facilities on their stigma and discrimination quality improvement activities, support of peer learning and exchange among facilities and province, and follow up the data collection completed in Q3 of 2019. And up to now, the implementation has been continued with the scale up of stigma and discrimination quality improvement activities in other 6 additional provinces. So that means from September 2018 until now, we have expanded the program on stigma and discrimination quality improvement into nearly 10 provinces. And in addition, the VAAC is currently developing standards of patient KP-friendly service and training material on KP sensitization for healthcare workers to implement the facilities level stigma and discrimination quality improvement activities here in Vietnam. So from the, I just want to say, from the research, from the finding to recommendation, the issues that the advocacy issues that we identify and focusing on, to the action, it takes a long time. But for Vietnam until now, it seems to be we think that it seems to be happy as we have achieved a little bit of achievement from the hard work during years. We're focusing on the stigma and discrimination for people living with HIV here in Vietnam. Yeah. So, thank you. Waiting for the question from participant, and now I just want to back to Sophie. Yeah.
Thanks so much, Dong. Next, we're going to hear from Pim. And then after that, I forgot to say that we're going to hear from Sasha, who's going to bring it all together for us. So please go ahead, Pim.
Hi, thanks, Sophie. Hi, everyone. Thanks for joining. So we would like to take this opportunity to actually introduce you to our PL-HIV Stigma Index Advocacy Toolkit that we had recently developed. The toolkit was launched in April this year. It's called Measure It, Act on It, Do It, using the PL-HIV Stigma Index to achieve change. Because measuring stigma alone is not going to actually do anything. And we want to make that change. We want to see the data being used to advocate for change. So therefore, we developed this toolkit, which equips PL-HIV networks who have implemented the stigma index to look at the findings and recommendations from the report and then take forward advocacy actions. The toolkit includes, well, hands-on tools. It includes sample timeframes and budget estimations for the activities. And we had it developed based on the framework of the global partnership setting so that it's easy to make the connection, which Sasha will be elaborating on after I present the toolkit. The toolkit is currently only available in English, but will soon also be available in French, Spanish, Portuguese, and Russian. So for everyone listening via the translation, the toolkit will soon be available in other languages as well. Next slide, please. So a quick overview of the toolkit. The toolkit is divided into two different stages. First, it looks at what needs to change based on the Stigma Index study. And then you will look at who can actually make that change. And it includes tools such as a prioritization grid, a meeting agenda, but also a tool on how to use the human rights system, an advocacy budget template, and an advocacy plan template. Next slide, please. So to quickly go into it a little bit more, stage one looks at what needs to change, and it starts off by reviewing the findings and recommendations from the report. So you look at the findings, but also at the recommendations that were drafted, and you look back on it and share your ideas and reflections as a group. Then you convene with the PLHIV network who were involved in the implementation, but also with other people who were involved in the Stigma Index implementation, such as other key stakeholders. You then present your key findings and recommendations and discuss this as a team. However, there will probably be a need to prioritize because it's likely that you'll have several key findings and recommendations, and you may not be able to address them all at once. So the prioritization grid, for instance, can be really helpful with this in trying to identify which are most urgent to address or which to address first. It's really important here to do this collectively as a team, so you're also building consensus and support for the advocacy strategy that you will develop. Next slide, please. So when you've looked at all your findings and you've prioritized, you move on to stage two. Who can actually make that change? Well, then you start off by mapping the different opportunities that are upcoming at national level, regional level, international level, and mapping the targets of your advocacy. Who has actually the power to make change? Who do you need to target in the priority areas that you have selected? And then you move on to the actual planning, step 4. After identifying the key policy processes, the people you need to target, and after selecting your priority areas, you can now develop your advocacy plan. The network of PLHIV should be leading this planning, just as the PLHIV Stigma Index project, with support from local partners, of course. It is a collaboration. And then you move on to planning the key dates and activities and really start to work it out into concrete actions. And you, of course, have to take into account the advocacy capacity. I think that was it of the PowerPoint. So this was a short overview of the advocacy toolkit. You can download this from our website, stigmaindex.org. And please keep an eye on the website because soon we will also make the translated versions of the toolkit available on our website. Well, we personally really think this will be a really helpful tool for communities to take forward advocacy actions after completing the Stigma Index study. We really need to use those results, all that work that went into that process and gathering that evidence base. And now this tool will help to turn that into concrete actions to actually help reduce stigma and discrimination. Back to you, Sophie.
Thanks so much, Pim, for sharing the toolkit. It's really exciting that this taking data to action is out there, and there's some clear supports and tools for folks. And now I'll turn it over to Sasha again, who's going to bring together the Stigma Index and the Global Partnership to show us how we can use these two tools together to really accelerate our efforts.
Thanks a lot. Can't open somehow my video, but anyway, trying to combine that. You can check your setting, the questions from the Stigma Index, and then you can actually compare them with the settings about which I was talking previously in the beginning. So, and then You can build that together. So yeah, my video is working. Hello. So you basically, you can look at section B, question this. These are questions which are connected with the justice system, and you can find data there. And according to that data, you can check what is the setting which was chosen by your own government if your country have already joined the global partnership. And it gives you basically, the global partnership is a political framework that helps you then to implement. And Stigma Index is an instrument which you can use to measure and advocate. Just global partnership can support this advocacy. You can find out, there were some questions there, you know, people were answering, like why we still have stigma in the healthcare settings. I think one of the reasons is we have to measure better. We have to measure through the Stigma Index, and Stigma Index, can we go next slide? Stigma Index have a lot of questions about the healthcare settings, and it's one of the main focus of the Stigma Index. So check what is there and choose the priority interventions and make it really focused. Because I think that sometimes we're implementing good interventions, but we're not relying them on the data, on the real situation, on the answers we're getting from people. If we will combine that better and we will synergize that better, I think we will get better interventions, more focused and more effective. Next slide, please. Can we go to next? Yeah, one more. So this is your advocacy checklist. Check your Global Fund proposal. Check if the global partnership interventions were included. Check if the people living in HIV Stigma Index is included, because it is important. Where from you are going to get data. Check your national plans. What is said there about the stigma and discrimination? What are the targets? What are the interventions? Then check your Stigma Index. When was it done? Was it done recently? If not, advocate for its implementation. Then, guys, read Global Partnership Evidence Document. And I believe Emily was putting that in the comments. Then read People Living in HIV Stigma Index Advocacy Tool. And then check, what data do you have? What interventions do you need? Build your advocacy strategy and start implementing it using the resources you have. Next slide. So basically, Stigma Index helps you to identify most important priority interventions, make them focused. Then that should be then supported by the global partnership. And that will give you a better understanding what is your strategy. Stigma Index data is your instrument and advocacy for most important interventions. At the same time, global partnership is a platform and instrument to advocate for the Stigma Index results. And also, which is also quite important, Stigma Index helps you to measure this progress and check if you are getting closer to the goal of the global partnership and goal of all of us, to eliminate all forms of HIV-related stigma and discrimination. Thank you. Over to Sophie.
Thanks so much, Sasha. You brought the two pieces together really well. I want to say that we've had a ton of activity on the chat, and now we're going to transition into the most exciting part of the panel. Not that everyone's presentations weren't thrilling and exciting, they definitely were, but now we get to respond to some questions from the folks who are watching on Zoom and on Facebook Live. So the first question, and Sasha partially answered this in terms of measuring it, but you know, one of the questions that was raised is, after everything that's gone on and the recognition of how damaging stigma and discrimination is to the HIV response, how is it sort of possible that here we have arrived in 2020 and we're still having high rates of stigma in the healthcare system? So, you know, I'd like to put that question first to Anna, but if there are other panelists who want to respond based on their experiences and expertise, please go ahead.
Thank you so much, Sasha. So generally, I think the challenge is that each and every country has a particular context, and it also has its different challenges when it comes to issues to do with policy frameworks and the laws within that country and the level of acceptance within people within that country. So you'd find that we will still face different levels of stigma and discrimination targeted at either PLHIV, either drug users, either sex workers, with different groups, just because we have different contexts. For example, I'll use Zimbabwe as an example. You'd find that we had challenges with key groups such as those women who were selling sex, and also people belonging to the LGBTI community. So you would find that there were a number of restrictive laws and policies within that. And then when it came to HIV, you'd find that most people were starting to warm up within service for provision for people living with HIV. We kind of like normalized it through all that we had gone through throughout the years. So, but when it came to people living with HIV who also identified as lesbian, as gay, as trans, or as selling sex, or as a drug user, it kind of just changed. People would then react to them in a kind of different way because they are looking at them within a certain box that they are lesbian, they are gay, or they are trans, and they start to judge them. So before they actually then offer the services, they're still trying to figure out, how are they gay? How are they selling sex? How are they lesbian? Or how are they trans? So you would find that then stigma would then perpetuate and then go on and on. But now, because we're moving towards kind of like aligning certain laws and policies and making sure the environment is more accepting and more friendly, things are starting to change. Healthcare providers are starting to be sensitized and the likes. So I feel like it is a process, and it's not an event. It doesn't end overnight. But what's important is to go through that process, track that process, and really see the areas and gaps that we need to address as communities of people living with HIV, such that everyone is in a way that they are understanding of the different communities.
Thank you, Anna. Does anyone else from the panel, or Sasha, do you have anything you want to add? I think what Anna's pointed out in terms of the patchwork, not taking a patchwork approach to addressing different kinds of stigma, but working on them systematically is really, really important advice. And anyone else have anything they want to share about how to? Sasha, go ahead. Sorry.
Yeah, I think just couple of things. I think important, to align all that initiatives together, but also it's very important to work together. And I think, like Harry was talking about, that I think like just contact the guys in nearest countries. Look how they were doing that. Yeah, contact us, get technical support. Don't stay alone. You don't need to work alone on all that. Yeah, and we are here, to help and support each other. So we definitely can do that together. And it is rather a long way to go. And basically, all these settings and everything is quite connected, because if you are working just in healthcare and you are not working in education, then you got the doctors which are, again, don't know anything. So it is connected, and it takes years. We're talking about stigma and discrimination. It's about beliefs. It's about people's, brains, souls. So it takes quite a long time. But if we're doing that together in a very, like combined approach, we can do that.
Harry?
Yes, so I do think that by having the stigma index, we can use this as a baseline on how we're gonna working towards whatever setting that you are trying to focus on. Let's say, when we know we have a stigma index, we know the baseline, which way when we go to measure it, and how you're gonna work on the process of, to eliminate, to reduce stigma index in healthcare settings, or in the workplace, or in the household. I think that's very important. That's why it's really connected. Why stigma index and global partnership on those 6 settings that we have is also really, really linked to each other.
Okay, Pim, did you have something you wanted to add, or anyone else, or move on to the next question? Or
Well, it's a combination of everything just said, right? I think stigma is a social construct. We cannot just change it overnight. We've only been measuring it for the last couple of years, maybe a decade or so, maybe a bit longer, but at least systematically. And measuring is only part of that. And then we still need to take action and make that change. And changing people's attitudes and changing norms in society, it takes time. So I think we need to be patient, but we also need to keep fighting and systematically fighting, not just here and there. But we're getting there. A lot is happening, so that's good.
I think that's a really important point, Pim, and especially in the context of COVID-19, we know that stigma and discrimination is evolving. So keeping up a systematic approach will help us identify new and evolving aspects of stigma and discrimination as we navigate these tricky COVID-19 waters. We have a very specific question from the group relating to the global partnership, so I'll direct this to Sasha. They asked, why did Brazil not join the partnership? And I think the larger question is, in the context where you have a country that for whatever reason isn't going to join, what can communities do to kind of strongly encourage countries to join us?
Brazil is a challenge, but not only Brazil, it is the same, unfortunately, story with Indonesia, and it's about the political context, and it's about the government which is in power now, and communities were advocating really a lot. And in some countries, we were successful. I can say Ukraine wasn't easy. Wasn't easy at all. Valeria and all other guys were like advocating a lot in there. Argentina was not easy. A lot of advocacy was done, I'm being honest, I was thinking that because of the COVID, all that would just stop. I can say great win is just even during the COVID now, the countries are joining. Recently, Thailand have joined, like Ukraine have joined already after the COVID-19 pandemic have started. I was thinking, I was even to ask for more budgets, to support the communities there, because I wasn't expecting even it to be so successful. There would be new waves, and also we all know political situations, they change, right? Now it's one government. After several years, it will be the other government. It's more complicated with dictatorships. The governments will stay. But with the countries where the governments do change, we still have a chances. And please come to us, contact. Let's discuss how we will advocate for your countries. We are also going to build the list of the new wave, or the second wave of countries joining the global partnership. We need advice from the ground. So just come and let's discuss.
Valeria or anyone else, do you want to comment on how you helped, overcome challenges or resistance at the country level to joining the global partnership?
Yes, please, if I may. I can give you just one advice. Communicate, communicate, and communicate. Because before Ukraine actually joined this global partnership, we had like a really, really tough political times. Our Ministry of Health changed 4 times during 6 months. So it's not, we had no political will. We had no even the same staff in the Ministry of Health. We had no any supporters because the political situation in all the country changed a lot, and not in the favor of the communities and non-government organizations. So don't give up, communicate, try to find all the ways, find the supporters, because the United Nations and Global Fund, they do support us, and we can rely on it, on them. So and their support. Try go through UN Women, UNAIDS, UNFPA. Try to find people who can help you on all the stages. So we communicated with our Ministry of Health during, I think, 6 months. 6 months, every week communication. So, and finally, bam, 4 settings. Well done. Thank you.
That's great. That's excellent. I don't know if anyone else has any thoughts, but one of the things that I think is an important leverage point is that I definitely think governments are recognizing that particularly networks and communities of people living with HIV are really well equipped to respond to, stigma and discrimination on the ground. And COVID-19 has really been highlighting that, I think, in a lot of ways, because communities have been ready to mobilize. They've been out there responding to the needs of communities. And really reaching deeply into communities in ways that it's been challenging for governments to do so. So I think it's a really important sort of political leverage point right now for some of those discussions around why their increased investment in communities is really necessary. So I'll let anyone, you have to put your hand up and let me know if you want to have anything more to say about that. Now, there's a question that's come up, and it's definitely something that comes up at ICW all the time as we think about the ways in which misogyny and discrimination against women in particular at the country level, national level, even global levels kind of impacts the way that women in particular can engage in the various processes, and even if we're frank, even at the community level, understanding how networks can engage. And one of the questions is about how to overcome the impact of this marginalization at all levels, and how do you guys go about making sure that you're engaging women and networks of women living with HIV at all levels of the process? And I'll kind of open that up to the panel, but I see Anna nodding her head, and she may have some great things to share. So Anna, if you want to, or anyone else wants to respond.
Okay, thanks so much, Sophie. So maybe my just two thoughts is, I think it's really important as groups of young women, girls, or women within a specific country context to organize yourselves in the way that you also want to present yourselves, and also in a way that you want to engage in. I think that's very, very important, the level of coordination and organizing that you are within a specific country context, and also the issue around being very clear around the issues that you want to address when it comes to stigma and discrimination, and really not being afraid to speak out and really demand that space when it's not being given to. Because I know most of the times you can be left out and then we cower down and then we're quiet. But I think it's really important to exercise our voice, especially for young women and girls. I think it's really important to ensure that you speak out for what you want to stand for and what you want to address. So, but the most important is organizing ourselves and coordinating ourselves in a way that we know will help us engage within different platforms.
Oh,
I was muted.
So, yeah.
You want to go ahead and weigh in?
Yes. So I think I can say for the Stigma Index, we really try, of course, one of our main principles and focus is always on inclusion throughout the process, not just as participants. We're always trying to make sure that PLHIV in all their diversity are not just included in the process, but leading the process, and that includes women. And I think a good example here is what's currently happening in Nepal, because we're seeing a collaboration between the national network of people living with HIV and the women's network. And they are co-leading the implementation. And I think that's really great to see that, again, I mean, it's come up before, but collaboration, working together with all the stakeholders, and it's just essential for the process to be meaningful. So I think that's how we're approaching this from Stigma Index side.
So I think that's really great. And one thing I'll add in terms of, we've talked about kind of the responsibility of networks to fight hard and to organize themselves, and the creating opportunities for collaboration. But I also think that in some ways this has to be addressed structurally, right? In the actual initial plan, when people are thinking about who needs to be at the table as we approach a country around joining the global partnership, who needs to be at the table as we understand how we're going to structure our stigma index process and the advocacy that comes out of it, and really being open to listening to all voices at the table and creating that space, and from the beginning all the way to kind of when the rubber meets the road in terms of however the program is getting implemented. Because if that space isn't created, it's still very hard in certain contexts for women to demand that space. And it's true for other marginalized populations. So, it's something that's a good rule of thumb, whether you're thinking about how to engage, key populations or networks of women. Harry, I saw you nodding. I don't know if you want to add, if you have some thoughts you want to add. If you nod, I'm going to call on you. That's how this works. Okay, so we actually have quite a few questions in the Q&A. The next question I'm gonna go with is about the Cambodian Stigma Index. Somebody asked, the report has come out, but it hasn't generated any necessarily, advocacy outputs, and there hasn't been much change as a result of the report. So what can someone do in this situation? And Pim, I know you have some experience with this, so I'll direct it to you, and then I don't know if anyone else kind of wants to jump in with some thoughts.
Right. So that's actually good that you bring it up, and really fitting, right, with this session, because this is why we've just developed the advocacy toolkit. But also to say that the report, I believe it's been only recently launched. So again, change takes time. You're not just going to measure stigma and 2 months later, the environment will have changed. Plus, we need to come up with strategies. We don't just want to have a finding and take some action. We need to come up with a way to, a good strategy to approach this in a systematic way. So just to say, again, it takes time. And what we're doing is to support networks. Anna, maybe you want to say something. Anna has just joined the GMP Plus team as the advocacy officer. So she'll be supporting countries with their advocacy. So we're just trying to support as best as we can, even after the study has been completed, on how we can use the results for action.
Fantastic. Anna or anyone else want to comment on the advocacy toolkit, or how to foment advocacy or revolution, but mostly advocacy at this point?
Yeah, I think what's important is to be able to adopt the advocacy toolkit within your specific country context, and be able to make sure that you engage the relevant stakeholders that can really help you drive the implementation of that advocacy toolkit. I think that's really, really important. And it's also important to align it with some of the work that you will be doing as networks previously that links with advocacy, such that you also are really seeing the change and the progress that you can make as a network at country level. So it's very, very important to make sure that you align it with the work that you're currently doing, but adopt it within your country context. I think it's not supposed to be in a way of trying to disrupt the level of advocacy that you're already doing in country, but to complement that and also really amplify it as well. And like Pim said, we are really open to giving that level of technical support and guidance to ensure that networks of people living with HIV are able to really transmit the data into action and are able to effect the change that they want to effect following up to the stigma index implementation.
I muted myself. Okay, we have one more question from the chat, and one of the big challenges facing communities is always, how do we? This is great. We have these great plans, but how are we going to pay for this? And so I think thinking about from your perspective as people who are really doing this work and have had some great success with getting these kinds of programs, particularly advocacy, financial support for advocacy. How do we address that challenge? And I'm going to put this to Dong and ask, if he can share from his experience, what are some strategies or thoughts around how to get this work resourced?
Yeah, I think it's there are some important point, but the most important thing that in terms of the advocacy, in order to have the effective advocacy plan, is that the involvement, how to say in English, but the involvement of the government in the process. I mean, I don't know what happened in other countries, but in my country, there are many local NGO who conduct research, but it seems to be the finding, the report seem to be not to be heard by government, because they are not involved at the beginning. So sometimes it's too difficult for government to clearly understand or recognize the thing that we find from the research. So the most important thing that the lesson learned from last 2 rounds in the past that we have conduct on stigma and discrimination is the very important thing that the government need to be involved at the beginning of the of the process to design structure the stigma index. Yeah, so they should not be involved too much. The government should not to involve too much, but they need to involve in the process to design the research in order to help us provide technical support or something. And then the recognition is very important when the finding of the come out from the research. So it will be very useful for the community to use in terms of advocacy. Yeah. So it will take the short time and easier when we focus on the government who are our target audience. Yeah.
That's really, really exciting to think about how to build that relationship over time and really present the information about what the challenges are in order to get them on board as a partner. Very smart. Okay, does anyone else want to respond with ideas about how people can resource this work?
Yeah.
Pim?
If I may.
Yeah, please do.
For the stigma index, we are encouraging country teams to already include it in the initial budget, because even if you're getting funds from PEPFAR or Global Funds, they also want you to act on the results. So include it from the start, support for the network to use the findings, because just measuring isn't going to do anything. Mm-hmm. So I think just making that clear from the start that there will be follow-up needed. I think that's essential.
Okay, that's totally agree with that. If you don't measure it, you can't understand it. But if you only measure it, you can't fix it.
Right? Exactly.
Any other thoughts on resourcing?
I can say a couple of words on resourcing, and there was a question about the global partnership. Also, can answer that one.
Okay, great. Well, to
about
Sasha,
the resources
question that's in the box.
Yeah. About the resources, I think it's also, that was one of the reasons why we were advocating so strongly that Global Fund actually will become and it became already the co-convener of the Global Partnership, because we need donors at the table and we need them to understand, what and how they have to support. But we also have to use that, quite strategically. And sometimes, and we already were discussing about this national consultation, sometimes it's very hard to come to, all the communities are very different. Everyone wants their own interventions to be funded. But we have to choose the priority ones, and we have to come to the consensus. And sometimes it's very hard decisions, and you have to prioritize these interventions, but not that, because there's not enough money. It's obvious, and you have to put something in the first place and then something in the second row. Never was easy. Answering the question about the global partnership, yes, there is quite a big difference, we have a lot of interventions, a lot of data. They are quite developed, justice and healthcare. But when it comes to the other settings, it actually is very challenging, because for the humanitarian and emergencies, the number of interventions which were like really good described, and we have lots of data, it's almost zero, So for some of the settings, global partnership is also, the idea is that we will implement the interventions, we will collect the information about how they do work on the ground. So, and the same about the education. If you look at the list of the countries, only 2 countries have picked up the education. Only a few countries have, like, I think one have, Thailand, I think, have picked up the workplace. So I think there is difference, but me personally, I don't think that they work one without the other. That's the thing. And I think that's how we're missing the target. We have to act across, otherwise it won't be working. We're mostly focused on the ministries of health, right? But that's not, it won't be solved like that. We have to work with the rest of the settings as well.
Harry, you had your hand raised. I'm sorry, it's difficult for me to see the hand raises. Jump in there.
All right then. So I think I just want to add what Dong has been said, and Pim also been said that when you talk to work advocacy, I think you involve the government at the very beginning, and also try to put evidence base on the tables. But also we should not also just criticizing when you advocacy, but we also give a solution to fix the things. So in order to get trust and in order to get, okay, so we trust you, so we believe your advocacy really works, so then maybe we can get more resource to do more advocacy on other issues as well. That's my point. Thank you. Over to you, Sophie.
Excellent. I just want to thank briefly, before we move on to sort of a final round of comments from the panelists, the team who is helping me get through the questions on the chat and helping me to sort of identify and answer some of the questions in the chat, because we've had a lot of questions and more coming in from Facebook Live. So one of the things we just wanted to respond that that I think everyone on this panel, and certainly all of our organizations, agree that, AIDS is not over. It should not be ignored or forgotten or understood as a resolved issue within the HIV/AIDS response. And I think that's something that we are all within our organizations actively trying to, keep HIV and AIDS on the agenda. So just to comment to one of the things that was raised in the chat, I want to give all of our panelists an opportunity to say, to share a few final thoughts about this work and any sort of advice or guidance that they want to give to community networks who are watching at home and thinking about how they might take the first step to kind of get involved with this or to leverage existing efforts. So I don't have any particular order for this, and I can't see hands. So if you want to unmute yourself, we'll just make it sort of a final free-for-all, and you can make your comments. Someone does have to go first.
Okay, I can go. Okay. Well, maybe in conclusion, it's important to say that I saw all that questions in the chat box, like saying like when we will end that, why it's not still over, you know, we're working so long, so hard. And I wanted to say that it is a process. It will take us a long time. You know, it's the same as with the other kinds of, you know, xenophobia and all that stuff. It's a long way to go. Never was easy. But I think that we have pretty good progress by now. And I also think that the recent situation with the COVID-19, which also shows that all that criminalization, discrimination, stigma, it just works against if you want to overcome an epidemic, you should stop that. It just doesn't work. So I think maybe that lesson will also help us. I think we have 30 years of understanding how that diseases, fears, and all that work. So we can share that with the COVID epidemic. And I really hope that people like decision makers and all that people in governments, they now do understand. Because now it's about everyone, you know, HIV epidemic is very specific, but now we can see the same story coming up again and again. So that is my hope as well. And thanks a lot for the session. That was great.
Harry?
Okay, so I think for me it's like, when we work on stigma and discrimination, I think, do not forget to put community at the center of the process, because it's very crucial, because we the one who can change the stigma, discrimination, and we the one who facing the stigma and discrimination. Therefore, and then also don't forget to, when we do a lot of work on stigma and discrimination, but sometimes we just forget, there is no channel when we can complain about stigma that we're facing on. So maybe the best way also to suggest create a safe channel for community to be able to complain and to report the stigma and discrimination they experience. And also another things, maybe, in order for us to be aware that, other people are facing stigma and discrimination, I think those who are being a moderator for the channel of complaining should respond it. I mean, they know that they know that they're being looked after. They've been, so people will have the trust, confidence to report if they're facing stigma and discrimination. That's on my side. We'll be talking about stigma and discrimination. Over to you, Selfie.
Dong or Valeria, you want to final thoughts, advice for those?
Yes, please. I have noticed that we live in this stigma and discrimination, and I think we know from our own experience, from experience of our friends and acquaintances, almost everything about it. But it's a mistake to think that all other world feel the same and have the same knowledges. For most of the world, our stigma, discrimination, our troubles really doesn't exist. Like we, 38 millions of HIV positive people, we are not existing for them. So if you want world without stigma and discrimination, if you want the world based on the respect to human rights, we have to inform people that we are in trouble. We need for this more activists with open faces, because it's too little of us, and we cannot fight on all the front lines in this world. And we have to fight for it every day and let people know in such a troubles we are. And I want to thank this global partnership and initiators of it, and all the civil society and people living with HIV from all over the world who supported this initiative. All our donors, that they led us to have one more great, really great advocacy tool based on our needs, developed by us and for us. So thank you. Let's fight together.
Anna or Dong, go ahead.
Yeah, I think nearly 40 cases we are working and fighting in the HIV field. Yeah, but stigma and discrimination seem to be not disappear. It's still existing in the community everywhere. In many countries, it's very high, and in some countries, it can be reduced a little bit. But it changed into different shape of this different kind of the stigma and discrimination. So we know that many of us are working in order to help people living with HIV to access to healthcare service, to support people to access to treatment. But I think that stigma and discrimination is the most important issues, the first issues that barrier people, that prevent people living with HIV from the access to the available service. And we think that it's not easy to fighting with the stigma and discrimination, and it might take a long time, as we have been working on that. But I think it's the most important. So let's start it. Yeah, let's start. So I think once we start working and fighting on that, so the distance may be short. Yeah, I think so. Yeah.
Thank you, Dong. Anna?
Thank you, Sophie. And I just want to echo what everyone was saying. It's not going to be an overnight event to eradicate stigma, but it's going to be a process. But what we're grateful for in that process is we're going to be empowered, we're going to be informed, and we're going to be more knowledgeable around the issues around us and also what we need to do within those issues. Because I believe that when we are, so I had to write it down so that I don't forget. When we're informed, we're able to know what we're fighting for, and when we're more engaged and really have the knowledge around knowing about our rights, we really can try and win that battle. So it's not an overnight process, but let's be grateful with the tools that are going to be available, with the technical support that is there. We're going to emerge informed, capacitated, empowered, and really knowing what we want to stand for and what we want to fight for.
Thank you, Anna. Thank you. Pim?
Well, not much to add to all of that. I think that was great. But just let's not forget, it's a massive challenge, eliminating stigma. It's a huge task, and I think we can only do it together and just keep on fighting.
Thanks,
so let's do it.
These are some really, really powerful calls to action from all of you. And I think this has been a really incredible, informative session with lots of examples and resources, and even more resources being shared in the chat by the people who are participating. I'd like to thank Pim in particular for doing all of the hard work of organizing this. And also thank everyone who has joined us via Facebook Live and also on Zoom, and for participating in the chat and sharing so much information and questions and really engaging. I think the panelists have kind of said it all, but if we had to sum it up, it's that community has to be at the center. And we have to work together, and we have to rely, I think, on what community, particularly the communities of people living with HIV, have in spades, and that is resilience and endurance to continue these efforts, and to continue with innovation, and really leveraging the energy, enthusiasm, and passion of everyone on this panel and everyone who's attending to kind of really accelerate all of the efforts that networks are doing, and to move this, to keep plugging away and move it bit by bit, slowly by slowly, day by day. So I thank you all. And with that, we'll close the session. And I think the chat boxes may still be open on Facebook. So people are responding to questions there. So if there's anything burning that people want to share, that's your place to do it. Thank you all very, very much for your time and expertise and wisdom and your passion. I sort of want to do like a little go fight win at the end, but yeah, so I did it, but yeah, it was good. Thank you all very much. This was great.